A 3D innovation in digital diabetes from a tertiary care diabetes center in India will be presented by Dr. Praveen, and the group is from India. Dr. Praveen.
Thank you, sir. Thank you. Audible? Am I audible? Yeah. Good afternoon, everyone. This is Dr. Praveen. I'll be speaking on a 3D innovation from a digital center, from a tertiary care center in India. We all know that people with diabetes need a comprehensive and a holistic care in form of regular follow-up, testing, compliance with medications, diet and physical activity. India has over 600 million smartphone users, and post-COVID, the acceptance of telemedicine as well as the digital health apps have increased. Using this technology in the management of diabetes has definitely helped in the continuum of care between our patients and the healthcare providers. We aim to evaluate whether a novel 3D digital model can help people with diabetes achieve better outcomes and bridge these gaps in the care. It's exactly a year back we launched this model, and you can see that out of the 3Ds, the first one stands for Dia. Dia is a WhatsApp-based AI chatbot. She's available across WhatsApp, website, Facebook, as well as Google My Business. Currently, there are almost 40,000 users, and this is available for everyone who's interested in management of diabetes as well as the other NCDs. You get a whole lot of information regarding the lifestyle habits, prevention, obesity, in a very layman term over your chatbot. Also, you have your FAQs related to diabetes. Next one is the Diala with the second D, and Diala is a lifestyle assistant, diabetes clinical assistant app, mainly for our patients registered with us, and it is available both on Android and iOS, and there are almost 39,000 plus users on Diala. And the most important part is these patients can track their health records. They can log in their daily glucose values, their home monitoring values, their calorie intake, their steps, as well as log in their weight and blood pressure. This is how the SMBG values looks. You almost get a CGM kind of a graph when they log in their self-monitoring values, and this can be shared with their respective healthcare providers. They can log in their food items, what they regularly take. They also have a knowledge center with up-to-date information with respect to diabetes and its complications. Coming to the last part, that is the D, the third D, that is Diana. Diana is a precision medicine diabetes tool. She helps to classify type 2, newly detected type 2 diabetes into specific subgroups in the Asian Indians, and also their likelihood of the treatment, what they would respond, as well as the risk of complications. We all know this, the 4 novel subgroups which has been described in our Asian Indians. Apart from we all know the Scandinavian clusters, but there are 2 novel clusters which has been described in our paper. We have the SID, the severe insulin deficient subtype, the IROID, the insulin resistant subtype, as well as the combined insulin resistant as well as deficient subtype, as well as the mild diabetes or the mild age-related diabetes. So you have these 2 novel clusters which is more specific for our clusters, and you have the tool here. All you need to do for the primary care physicians is to enter these details: age at diagnosis, BMI, waist circumference, A1C, triglycerides, HDL cholesterol. You add C-peptide, the accuracy goes up to 99%. So even without C-peptide, the accuracy is almost close to 75 to 80%, especially in the resource poor settings. And obviously, when you include this, it also gives you what subtype of diabetes it is and what is the possibility of the complications. For example, you take the SID there, you have more likelihood of retinopathy, so you can screen them earlier. It also gives you suggestions about what medicines can work with them, probably insulin or sulfonylurea. So basically, you are more aggressive in managing these subtypes. Together, the focus is on Diala today, my talk. So together we have almost 79,000 plus users with Dia and Diala, and people who have used our apps over the last 1 year. You can see that there has been a statistically significant improvement in the glycemic parameters. The A1C has come down in both male and female, as well as the LDL cholesterol also has come down, whereas the other parameters have at least remained stable. And surprisingly, most of our users have been above the age of 50 years, so which is quite a surprise for us. But it's glad that more and more people are open for digital technology. So to conclude, people with diabetes have most commonly used our app for tracking their health records as well as connecting with our healthcare providers. And among the active users who have used our app, the preliminary analysis has showed statistically significant improvement in the FBS, PPBS, the A1C and the LDL cholesterol. All the other variables have remained stable. 3D is a futuristic scalable enable technological innovation that can enable people with diabetes a greater access to care, lowered costs within the healthcare system, and improved outcomes through better diagnosis and treatment. Thank you. I'd like to thank my Professor V. Mohan and also the Managing Director RM Anjana for this opportunity. Thank you.
Thank you very much. Very fine presentation. Question?
Two questions. Okay now? Okay. So question number one, for the segments of your patients, for those segments, is what do doctors do differently based on the different segments? Is there a protocol for the different segments? That's question one. Question number two, for your app, is there a program patients follow to use the app, or do they just use it how they want to use it?
Thank you. So regarding the first question, you meant regarding the subtypes of diabetes, how do you have an algorithm, right? Yeah.
So the first question, we are doing a randomized clinical trial where we classify them into these 4 subgroups, and each of those subgroups, we then treat the control group in the conventional way and the intervention group based on pathophysiology. So a secretagogue for the insulin deficient type, a sensitizer for the IROD group, and a combined one for the combined one. So that study called as aggregate study is in progress. We will present it probably at the next EASD. But meanwhile, the clinicians, based on their inputs, because it's already telling them which type they have, it's also suggesting what drugs to use, so they can have an informed decision whether to use what the algorithm is being recommended, or they can choose what they want. The second one.
So basically, the apps is most of the things are self-explanatory, but again, depends. We do a basic formal training. It's easy to understand using the tracking their health records or monitoring their SMBG values. So our diabetes educators kind of give them a snapshot of how to go about the app. And again, if any help is required, we try to train them so that they can use it better.
Thank you very much. Thank you. The last presentation